Right, okay, just a little bit of a background about me before we start. My name's Chris. I've been within the digital media industry for more years than I can remember now. Specifically had 10 years NHS experience, creating initially sort of online learning content for my colleagues within the NHS, but then looking more at smart systems, so learning management systems. We started to create some apps specifically around training and nursery validation. I managed the intranet and the internet whilst I was there, or teams of people, I should say. So quite well versed, I guess, with the digital challenge that people are facing and the resources that are available within different organisations to be able to meet these sort of challenges. My interest really in all of this, in all of digital, really is about making it easy for people. And I think that's at the heart of what we want to do here at Piota. Make it easy for people. So whether that's patients, families, and carers out in the community, or whether that's your colleagues working on the on the front line, if we can make it easy for them, if we can create quality digital solutions that people don't have to think about too much, they can just get on with them and operate them and get the information they need, and I think we're winning. So as an organisation, Piota have been around for about 4 or 5 years. We've been in the healthcare space now for about 3. But we've got about 130 apps out there in the sort of health and social care. Some of our biggest clients, NHS England, Public Health Wales. We do lots of work with different trusts, ICSs, the old TCGs, and different teams within organisations. And a lot of these organisations are coming to Piota because they've seen the Piota solution, they recognise it as a piece of software that they can use, and a lot of time they don't have resources internally to be able to create their own apps. They understand there's a need. They work with the patients. They're wanting to provide a better patient experience. They want to provide them with localised information. They just don't necessarily have the resources, the capability, or the experience to be able to do it themselves. So that's kind of where we fit into the equation. Now, the Piota App solution is a sort of template-driven solution, and all our apps look the same. We can customise those to meet the needs of our clients. At the top half of the screen, we'll have some kind of logo, and then at the bottom half of the screen, which is this sort of 3x3 grid, which we call our tiles. That's kind of your menu system. There are certain functions that sort of run behind the menu system. But as I say, all of this can be very, very quickly customised and updated for different teams. So we do staff engagement apps. This one's an app designed at young children coming into hospital for the first time, and what they can expect, meeting the team, meeting the environment, what's going to happen. This one's about transition. So for young people going into the adults section of the hospital, about what they can expect, all the information they'll need. So these are all sort of single sources of truth, information provided by the different teams directly to their audiences. And I kind of I say audiences. Historically, it was patients, families, and carers. But more frequently now, we're seeing these apps being used for staff communication, especially for remote staff, remote colleagues that don't necessarily have an office or a desktop, to be able to reach out to colleagues and provide them with all the information, with all the opportunities, is becoming more and more apparent. So all of our apps, as I say, look slightly different for different teams doing different things, but essentially it's the same app behind the scenes. We as an organisation work with you to understand what you want us to do, to be able to create an app, to show you how to use it, and then almost take a backward step. We're not traditional developers. We're not sort of updating the content. You are, once we set it up, this is down to your team then to kind of manage and keep the content updated. And it's really, really easy to do. I think that's the beauty of it, and I think that's why a lot of our clients like working with us or come to us in the first place, because they want that control. Ordinarily they may be providing comms teams or IT teams with all this information. Can you put this onto the web or onto the intranet? Or they can just do it themselves. It's really, really simple, and I'll show you a couple of examples of how quick it can be later on. So first thing about improving the patient experience. So again, it's the same thought process. It's the teams that are wanting to provide their patients with all the information they can about the condition, about treatment, about the supports, the networks, the resources, the events, the different sessions, the different apps that are available. Listen to Christine earlier on. She talks about lifestyle medicine, and it really kind of touched something here about being able to use apps to be able to signpost people to different resources to ensure that they're aware that these different things exist. So, you know, all of these apps can create lots and lots of different content. We're not looking to reinvent the wheel with the apps that we create. What we're trying to create is, as I say, this sort of single source of truth, something that the team can roll out or you know, provide links to or encourage their patients, families and carers to download and then use this as a medium to keep in contact with them on a regular basis. So this is a healthy weight app, so aimed at some colleagues up in Scotland that are looking obviously to provide people with information and education and awareness about managing their weight of their children, you know, themselves, their family members. So again, this is socially prescribed almost. You know, people when they're talking about health and weight will be suggested that they download this app. Lots of great information on here about, you know, the different aspects of weight management. But again, all of the content is all managed by the team at NHS Ayrshire and Arran. We will help them, work with them to get the app set up, show them how to use it, support them for the launch of their app, and then just take a backward step and, you know, provide them technical support throughout the contract of their apps. But this one, as I say, is for healthy weight. Lots of information, lots of news coming in from different sources. So bringing all of this information together and putting it into one place. You know, as a parent or as a patient in that particular area, I can pull out my phone wherever I am, and we're using them more and more and more. You're seeing it, you know, in everywhere we go. You know, people are sort of stuck to the phones. Just bringing all that information all into one place. So, you know, I can pull my phone out wherever I am within a couple of clicks. I'm getting all that relevant information, that localized information. It's not generic. It's not, you know, searching Dr. Google looking for answers. It's all in one place, almost like a sort of little safety blanket or a little comfort blanket, if you will. So again, this is information about teens and different activities that are, you know, that are in the community about teens and teens can come to. Again, you know, it's all about healthy living. They have sort of weekly topics that they share again with their patients. So you know, it might be to take more exercise, or, you know, different recipes to go and try, different networks to go and sort of visit, or different things that are happening. So you know, they've got lots of great activities in their community. Again, it's just making people aware of them, making sure that they know that they're there and they can go and join them, and they can have a, you know, much healthier lifestyle. I touched on this one. You know, they have all these sort of different recipes, and because it's a smartphone app, we can have things like push notifications. So once you've downloaded the app, you know, you'll get a regular update on the app itself, and a new session and a new sporting activity, a new recipe perhaps. So it's just a really great way of keeping people in contact. I think we're looking at our phones, the last time we saw some stats, on average about 3 hours a day. So a little glance here and a little glance there, just to see kind of what's happening. So yeah, this is just another modern way of grabbing people's attention and just alerting them to the fact that there's some new information, some new content out there. Yeah, this is the alert. So this is what we're kind of just talking about. So, you know, as you as the team send out information, alert will pop up on your phone, and then you can go and access it to see what that alert's all about. So that was one particularly for a healthy weight. This one is around a Macmillan support centre. So this one's been commissioned by Chester Royal Hospital up in the Midlands. And again, same principle, a little bit of customisation with the logo and the tiles. But again, it's that kind of single source of truth. You know, all the information that you as a new patient, or your families, your carers, your support bubble needs, we're going to put it all into this one place. And then when you're ready, you can come and access the app and get that information in a format that's you know, that kind of suits you. So again, we're not reinventing the wheel with any of this stuff. If the resources out there, you know, if there are all these different apps that people are using or people are suggesting, we can make links out to them. You know, where there's information on Macmillan, there'll be links out to Macmillan, or you know, other sort of, you know, cancer style websites. So it's, as I say, it's just having that sort of one place, that one-stop shop, where I can go as a patient, or, you know, as a family member or a carer, to go and get localized information about what's available to us, what's available to me, whether it be, you know, support, whether it be financial support, all of that information all in one place, quick and easy to find. The apps come in, use Google Translate to translate all the content into different languages. So I think there are over 120 different languages you can get. So teams are seeing the benefit of this almost immediately, where they can encourage their community to download the app and then select the text of their choice, and then be able to kind of start getting that information almost immediately. We do hear about people struggling a little bit to try to get translators or to get some information leaflets in all these different sort of languages, where the app just does it on the fly for these different communities. We've got a great contact section, or we'll have a contact section within the app. Again, all these buttons can be pressed, and if you press email, it will send an email out to the team, or similarly, if you press call, it will call straight through to that department. It's all about making it easy for people. If I've got a question, I want to go and call somebody, and I can just press a button, not having to transpose from a website to a bit of paper onto my phone and get the numbers mixed up and a bit stressed out and perhaps not do it. It's just making it easy for people. And if you make it easy for people, the more likely to do it. If it becomes a little bit overly complicated, then we'll probably do something else. So that's what I'm going to show. Obviously, we've got lots more apps to show, so if people are interested in creating an app or working with us, we can organise a meeting after this, and we can show you other apps that are more specific to your needs. So as I say, this is just kind of a bit of a run through, an overview of different things that we do. But we're seeing more and more organisations using the app to engage communication or engagement with their colleagues. I keep coming across this phrase of digital exclusion, where a lot of clinical staff, where a lot of kind of domestic staff that are typically, I suppose, on the front line, that don't have access to a desktop computer, that don't necessarily get the time during the working day to access a computer in their clinical environment, that miss a lot of opportunities for for different information that's key to them. So thinking about well-being, thinking about different events, competitions, just a whole plethora of information that's just not available to them because they don't have access to a computer. So we're seeing more and more that teams are using the app technology as a medium to be able to reach out to the staff. So whether it's putting a lot of this wellbeing information onto an app in the first place, or whether it's extending the intranet out, using the phone as the as this medium, or whether it's creating apps specifically for operational tasks. And this one I'm going to show you now is it's been commissioned by a team. The consultant at Dudley Hospitals recognised the staff were struggling a little bit getting access to some of the technologies, specifically PCs within the clinical environment, for a whole combination of reasons. But what he wants to do is provide his audience, which is a mix of permanent staff, locums, junior doctors, coming through the team, coming through the department with all the information they need quickly and easily. So this is the kind of app that we've come up with, and you can see by the labels on the menu, it's all of the guidelines, all of the policies. There's a directory of all different sort of consultants and different teams within the hospital. There's a whole host of forms for filling in. The rotas on here. There's information around training and CPD. So he's put himself into the shoes of his colleagues and kind of asked, what is it you want and what do you need? How can we make your life easier? If you can have your phone in your pocket, which you've probably got anyway, and you can lean to one side and pull your pocket out and get that information within a couple of clicks. How much time, how much effort are we going to save? The team on the whole by providing you this information at your fingertips. So as I say, really give it a good thought about what it's going to provide. And with all these things, they're organic. They kind of grow. You start off with a set of tiles and a set of information. People start to using it and appreciating it, and then can it do this and can it do that? Can it do the other? So just a really quick and easy way of really being able to engage and improve efficiency in some areas. So with this one being very much operational in terms of information, they don't want to share it with the general public. So the colleagues will first need to log in with the NHS.net email address. Once they've done that, they can go into the different departments and then pick up and access the different policies. So these are really, really quick. You press one button to get policies and procedures. You click on one of these hyperlinks, and it then loads you up, the specific page that kind of goes with it. It's really, really quick. It's a matter of minutes. You see some PDF documents or the links to the different resources where these guidelines and policies exist. So it can literally be done, while you're having a conversation. You can be looking to the bedside and pulling out your details and getting that information, within seconds, which, is saving them a hell of a lot of time. He's put on, I can't show you, but the rotor on the system for the team. So again, just thinking about, what information they need and when they'll access it. A lot of this stuff can be accessed from home or on the bus, on the train, or however you're commuting into work. So it's just always available. Lots of different forms, annual leave request forms, handover sheets, booking forms. All this stuff lives on the internet somewhere. It's just difficult to access for people. We're just laying it all out for his colleagues. It's all here. Fill in the forms. The response to the forms go to different secretaries or different administration teams, and they can access it immediately. It's just a very quick and slick way of ensuring the right people are getting the right information at the right time. Did talk about a directory. So this is a directory, and this is all of their different consultants. And again, clicking on the button will take you through direct to the secretary or to the mobile, depending on who it is and how they're registered. But again, the consultant here navigates through the switchboard of the hospital. So he's been able to put in a bunch of pauses. So rather than having to wait and speak to somebody at the switchboard, or press the button to press here 5 here and 4 here and 3 there and 2 there, this is all programmed in, and it just goes straight through to the number itself. Again, saving valuable seconds, but all those seconds, added together, save considerable time. There's lots of information on training, so for new folks coming through, all the information they need about the different training and where to get access is on here. Just a really great app, really thought about his colleagues and how they can improve efficiency and how they can just provide a lot of the information that they would need to necessarily go and search around the internet for, all on their devices, which they can access from wherever. Push notifications, alerts, so same principle again, different bits of information on here. He's got blood gas results, he's got Wi-Fi downtime, operationally whatever's happening. He can come in the first thing in the morning, find out whatever it is that day, and can send a push notification out to all of his colleagues. They pick it up on their phones, they can see it wherever they are, not having to drop in, access their email, going to sit behind a computer, try and get access to the internet. It's just directly on their phone. If they've got smart devices, it'll come through to the smart devices, make a little ping and come through. So, as I say, just a really, really quick and easy way of keeping in touch with people. So they're just three examples. I say I've got lots and lots of examples to show. If you've got specific projects or challenges in mind, come and talk to us, because I've got something to be able to show you that someone's done something similar before, and we can sort of demonstrate, the art of the possible, or how other people are approaching a similar sort of challenge. But the app solution itself, 2 aspects. We've got an online editor, dead easy to use. It's got an analytics engine, so you can see what people are using and how many people are logging in and which sections they're going to and what pages they're reading. So you can see, overall how much, traffic you're getting through the system, and you can analyse that, every time you log in. But essentially, you've got these sort of different icons, and as you go into the different icons, you can create these new pages, and these pages can consist of contacts directories, they can have calendars, they have information with links to websites, to different apps, to PDF documents, to phone numbers, to email addresses, you name it. But you quickly create the content, press publish, and it's live on the phone. If you use a push notification or alert, then the user will get a little push notification or alert on the phone. So it's easier, and from experience of working within organisations or working within organisations, it's probably easier to put your information directly into this little editor than it is to write an email to one of your colleagues asking them if they could do it. Again, it gives you that kind of control where it's your audience, you know them best. All the information, all the resources you kind of manage and curate. We're just providing you with a platform, your digital platform, where you can reach out and share that information with them. So super simple stuff. Just a little bit about process. Again, shouldn't be complicated. None of this should be complicated, really. Digital is meant to be easy, not sort of over onerous. But we'll have an initial conversation, initial inquiry, come back and say, I'm interested in this. We can have a brief team session where I can show you what we do and how we do it, and give you examples of work that we've done previously. we 9 times out of 10, if people are genuinely interested in taking this further forward, we can create a free trial. We can have that relatively quickly. And what we're trying to do is provide you with a story, I suppose. You know, you've got this sort of vision of how this could work and how your audience might benefit from this. But we can create your free trial, put some content in there, and give you this story to be able to share with your colleagues, or with patients, or with whomever it might be. You've got something that looks and feels like your organisation has got your content in there. You can start to kind of get feedback very, very quickly. That trial's absolutely free. You're not signing up for anything. We'll put the hours in to be able to develop that. If you're genuine, you think this is something will bring some benefit to your organisation. Once you've demonstrated that to your colleagues, obviously then you need to get agreement from your organisation, and that comes in various different ways. But again, we can kind of help you with that. And then it's almost, let's get the project kicked off and get the app sort of up and running with you. So in some instances this can take hours. I think the best one we did, well, not the best one we did, it's not a race, but one of the quickest ones we did was the same day. I think it was at the start of the pandemic. A team up into the West Midlands wanted an app to be able to share all information, operational information, with their care home staff about COVID and PPE and all of the new terms and things that were happening at that particular time. But yeah, basically came to us early doors on Tuesday morning. I think by the end of that day, the chief nurse there was emailing out all the care home managers, telling their care home teams to download this app. This is the way that we're going to kind of reach out and contact you from there on in. So yeah, literally did it within a working day. So it doesn't have to be so long and drawn out. Some teams can get this done relatively quickly. For others, it's a bit more of a challenge. But we're here to work with you and use our experience to help you wherever we can. It costs between £2,000 and £5,000 a year, depending on how many sort of users you've got of the system. So it's not a massively expensive app. I kind of get every penny counts within the NHS or within any sort of organisation in this moment in time. But it's not, from experience of actually trying to create teams and manage teams and salaries and all the costs that come associated with it, or working with third-party developers to create your apps. It's not a lot of money for kind of what you're getting. So as I say, more than happy to take questions now, but even happier to if you want to reach out to us after the event to come and talk to us, and we can show you in a bit more detail about what we do, how we do it, and how it can help you, and essentially how it can help your colleagues or your patients, families, or carers. So that's me. Thank you very much.
Thank you, Chris. Can you hear me okay?
I can hear you okay.
Absolutely perfect. Yeah, we've got a few quick questions which we'll run through. Okay. One of which, hello, can you hear me? I'm still here.
Yes, I can hear you. Yeah.
Yeah, I've just got the poll on the screen right now for everybody just to get involved in that. While we'll crack on with some questions. So one of the questions was about costing, which of course you covered at the end of the session. So hopefully Stuart has had those figures and is pleasantly surprised by them, which usually people are. So Thomas kicked us off here with a question really, or a kind of request. Thomas said, I've just been through the App Store and on Google and I can't find it. So Chris, can you just explain to Thomas the process, that it's all kind of bespoke, and the fact of why you won't find it on the App Store?
We've got, different clients have different ways of accessing it, but if you want to go and download an app called Health Zone UK, that's Health Zone UK. That's on either Apple or Google App Stores. You will see a sort of blue square with some helping hands as a little sort of outline. If you want to kind of download that, that will bring you then a little search bar, and then depending on your organisation, you can then search and find the app that you're looking for. Alternatively, organisations will have their own app in the App Store. So you as a patient or you as an organisation will talk to your colleagues or your audiences and say, if you go down to the App Store, we're NHS X, Y, and Z, download our app and you'll see all the information on there. So it all depends on who we're working with and how they're wanting to present the app or provide the app to their colleagues.
Perfect. Thank you very much. So Sian, is there any review process with translation? We have found medical information translated via Google is very hit and miss.
There isn't any. There isn't still now. We are using Google Translate just like most people do. There's a disclaimer that we provide when you change languages, which is editable. So you as an organisation can put your own disclaimer in there. We're not providing medical, well, a lot of our apps aren't providing medical education, so we're not prescribing or we're not telling you what to do in certain circumstances. A lot of the information we're providing is around the support, the different facilities that are available to people. So, we're not in that sort of medical device where we're giving you hard and fast information. We could do, but we're not doing that at the moment with our clients. So, we're in the hands of Google like most of the time.
Absolutely perfect. Cheers, Chris. Malcolm here with the final question, which is, this is not heard of this before, but Agilio TeamNet does something similar. How does Piota compare with TeamNet? Are you aware of TeamNet, Chris?
I've never heard of TeamNet. I'm sure there are lots of different sort of organisations out there that can do it. I'll make a note of that and have a little look. But no, I've never come across TeamNet yet, so I couldn't possibly say, Malcolm. Sorry.
Yeah, well, just to kind of let Malcolm know as well that Chris and your team, I think you're in about 130 health and social care.
Absolutely, health and social care clients out there with kind of our apps. So been around for a little while. We've got some experience now. The system's been around for a little while. It's robust. So yeah, I mean, come and talk to us. Always interested in looking at other projects and how they work. And different teams will take different applications for different reasons. So yeah, more than happy to talk to you and show you about how we can do and how we can help meet your challenges. Other teams might do it slightly differently. I don't know.
That's absolutely perfect. Just before we kind of move on, Stuart's mentioned that the GP TeamNet is web-based and most people in primary care have access to it on desktop. So it might be interesting to see how you could potentially attach onto that, really, Chris, as well. I'm sure it's probably more of a collaborative approach rather than a competitive one. So interesting for you.
So a lot of that information with these sort of web portals, web links, we can make direct links straight out to them. So I said what we're not trying to do is reinvent the wheel every time. Where this content, all this information already exists, we'll just signpost you to it. So we don't have at the moment, we don't have lots and lots of patient information siloing through the app itself. What we will do is we'll signpost you out to patient knows best, or other systems or other sources where that information can be retrieved. So yeah, we're an app solution. So our solutions are on smartphones as opposed to websites. But we are getting asked more and more, can we have a web version of the app as well? So watch this space. Yeah,
and that feeds into your final question there, Stuart. So hopefully you can pick the conversation up with Chris and the team, and we will make the slides and their contact details readily available. So Chris, absolute pleasure as usual. Thank you again.
Fantastic. Thank you guys. All the best.
See you now.